Dr. Zaher Sahloul has worked in hospitals in Gaza. He says the situation for health infrastructure and workers is dire.
As we have witnessed over the past year, that this war became a war on children and healthcare. More than 1,100 attacks were recorded by the World Health Organizations on healthcare in hospitals, clinics, ambulances. More than 1,100 doctors and nurses and medics were killed. More than 300 of them were detained. And now we're seeing this happening in north of Gaza, in Kamal Adwan Hospital. I visited this hospital a few years ago, and I know Dr. Hussam in person. I've been talking with him over the past year, every week or so. This is a humble hospital that provides health care to the children in north of Gaza, and it's right now closed. It has no patients, and all of their medical staff are either forced to leave or detained, including Dr. Hussam. So north of Gaza, that had population of 275,000, and three functioning hospitals, Kamal Udwan and Al Auda, an Indonesian, has right now no functioning facility. Indonesian hospital is working at very limited capacity. Basically, the Israeli army is forcing the population to leave by closing these hospitals. And there's nothing justifies closing a hospital or cutting the electricity on the ICU or detaining doctors, no matter what are these accusations that are unfounded. There's only 7 out of 39 hospitals right now that are functioning in Gaza. That means 5 out of 6 hospitals in Gaza is not functioning.
I want to get specifically to that hospital in a moment, but the Israeli government says that they are providing aid, as we've heard in that report just a moment ago. How do you respond to that?
I mean, the Israeli army has been saying that for the past year without any verification by a third party. As I've mentioned, I visited this hospital myself. Many of my colleagues who came from the United States and the UK and Europe and Australia visited Kamal Adwan, visited the Nasser Hospital, Al Shifa Hospital, other hospitals. They found nothing suspicious. These are hospitals like the hospital I practice in Chicago. These are doctors that insisted to serve their communities. They're not Hamas operatives. They denied any relationship to Hamas. Dr. Hussam Abu Safiya himself, his main concern was to make sure that the incubators have electricity for the newborn, that ventilators have the medicine and the oxygen for the children and on life support, that patients have medications. So no one believes these fabrications and lies anymore, and there's no proofs that the Israeli army has provided to the international community or verification by third party that these things are right.
And given there hasn't been that verification, we have heard, of course, that the Israeli government is saying that, quote, Dr. Safiya and others are being held on suspicion of being a Hamas terrorist operative. But given what you're saying, that they have actively distanced themselves from the Hamas group, what do you think this is all about?
I think it's about destroying the civilian infrastructure and the healthcare system in Gaza to make Gaza non-livable. We have seen that, by the way, in Syria, and that's why we had the refugee crisis in Syria, where half of the population have been displaced. When you remove a hospital, the community leaves. When you have 275,000 people living in north of Gaza that has three districts, Beit Lahia, Beit Hanun, and Jabalia, and 3 major hospitals, including Kamal Adwan, and now none of these hospitals are functioning, and now you have less than 50,000 people living in this area, there is a clear here pattern. And the Israeli army themselves, they said that they want north of Gaza to be free of civilians because they want to have military zones. So the intention, it looks like, it's to empty some areas from the population by forcing these hospitals to close. I mean, even if there is militarization of some hospitals, and this is not verified, that does not justify to close the hospital and not reopen it. Or it does not justify to cut electricity on the intensive care unit or bomb the radiology department or bomb the operating room or prevent medicine and medical supplies from getting to the patients. This is the essence of medical impartiality and medical neutrality, even in the time of war. This is the essence of Geneva Convention. And what the Israeli has been doing, providing health care, by the way, to the community and to the injured civilians in the war is not a crime. But attacking hospitals is a crime according to the international humanitarian law, and it's happening every day in Gaza.
And in terms of that militarisation that you mentioned, that's been the accusation, hasn't it, that Hamas is using these medical facilities to plan to carry out attacks. Is there anything that you've seen that would give you cause for concern that this might be happening?
I was in Gaza in January in medical mission. I stayed at that time in Rafah and worked in Nasser Hospital in Khan Yunis. And the same accusations were, by the way, thrown at Nasser and Al-Shifa Hospital. I worked in every department in the hospital, in the ICU, in the operating room, in the emergency department. Hundreds of my colleagues who came from outside of Gaza work in many hospitals in Gaza, and they found nothing suspicious. There were no areas that were blocked. There were no people who were shooting at the other side. There were no people who were associated with Hamas. It's hospitals like our hospitals. So we did not see any tunnels that the Israelis keep saying that there are tunnels and things like that. So I don't know where these accusations are coming from. They were not verified by a third party, and there were no proof that were given to the international community, to the World Health Organization that have been visiting these hospitals. So I don't believe these accusations, and no one believes them anymore.
And we've just seen, Dr. Zaher, a report come out from the United Nations really documenting a number of attacks between October the 12th, 2023 and June 30, 2024, saying that since the Hamas attacks, the conduct of hostilities in Gaza has had a severe consequence on Palestinians' access to medical attention. The report says, and I quote, "The destruction of the healthcare system in Gaza and the extent of killing of patients, staff and other civilians in these attacks is a direct consequence of the disregard for international humanitarian and human rights law." And there's been a response from Daniel Meron, Israel's permanent representative to the UN in Geneva, who described the report's data as fabricated, saying that Israel operates in accordance with international law, would never target innocent civilians, and accused Hamas of using Gaza hospitals of what's called, quote, terror activity. How do you respond to this report coming out from the United Nations overnight?
It confirms what I've been saying and what I've been witnessing. MedGlobal, my organization, have been providing healthcare in Gaza since 2019. We have right now 19 clinics throughout the geographic distribution in Gaza that provides healthcare, prenatal care, mental health support to 5,000 patients every day. We have a stabilization unit to treat the children with malnutrition in Kamal Adwan Hospital before it was closed. And now all of this is gone. And what we are seeing, and we're not the only ones who are seeing that, by the way, the human rights organizations, including Israeli human rights organization, the WHO, UNICEF, United Nations agencies, all of them came up with the reports that the impact of this war on health. War should not be attacking, during the war, you should not be attacking hospitals. You should not be closing hospitals. You should not be preventing patients from accessing to healthcare. This is happening every day in Gaza. There's 3 attacks on average every day in Gaza since October 7th on healthcare centers and ambulances and clinics. And there's 3 healthcare providers who are killed every day in Gaza since October 7th. If you do not name that attacks on healthcare, what's the name for that? This is crimes against humanity, against international humanitarian law that is happening every day in Gaza, and it should stop.
Doctor and President of MedGlobal, Dr. Zaher Sahloul, thank you so much for your company this morning and for your insights. We really do appreciate it.